Alright, let's make sense of something that sounds super complicated. EVLA 1940 nanometers. Ever heard of lasers fixing your veins? That's what EVLA, or endovenous laser ablation, is all about. But what's with the 1940 nanometers? Let's break it down. First, wavelength. Picture a wave at the beach. Wavelength is just the distance from one wave peak to the next. For lasers, we measure this in nanometers, which are crazy tiny, 1/1000th of a meter. So, a 1940 nanometers laser emits light with a wavelength of 1940 nanometers. That's invisible to us, living in the infrared zone, way past what our eyes can pick up. Now, frequency. Wavelength and frequency are best friends. They work together. When the wavelength goes up, the frequency goes down. Since 1940 nanometers is pretty long for light, its frequency is lower compared to visible light lasers. But here's the cool part. Even with lower frequency, the laser's energy is super focused. Let's talk power. The laser's power is measured in watts, and with EVLA, doctors can control exactly how much energy they use. This gives them precision, enough to close veins safely, but not so much that it fries everything nearby. Here's the science magic: chromophores. Think of chromophores as light magnets in your body. Different molecules absorb different colors or wavelengths of light. With EVLA at 1940 nanometers, the main chromophore that soaks up the laser light is water. That's important. Your blood and those vein walls are packed with water. Unlike older lasers, like the 1470 nanometers, which also got absorbed by red blood cells, the 1940 nanometers is super selective. It ignores red blood cells and targets water molecules in the vein wall. That means more energy is delivered exactly where it's needed, with less collateral damage. Why does this matter? Well, it leads to fewer side effects and complications. Since the 1940 nanometers laser is so specific, there's less risk of bruising, less pain, and less chance of nerve damage. The veins close up smoothly, and the healing process is often quicker and easier than with the old-school 1470 nanometers lasers. So, the next time you hear about EVLA 1940 nanometers, you'll know it's all about a laser tuned to just the right wavelength, delivering power right to the target, closing up veins with less trauma and a smoother recovery. Science doing its thing, making medicine better.